go to the sharing the screen mode. And it should be like this. Can you see it full screen now?
Not full screen, but we can see the slides.
Okay. So I guess now it's full. It is full screen for you.
Yes.
Mm-hmm. Okay, and now we are starting the new unit, which is called Instructions and Procedures. This is about some procedures which are done by medical practitioners to treat the patient or to do some investigations, and about the instructions that the doctors should follow doing these procedures. And the first slide here is about your homework. You were given the task to watch the video episode about the conversation of a nurse and a patient, and the task was to complete the gaps in the chart. So everything was okay, but I see that the students have seen the video, but some students just wrote some mysterious phrases in their papers, like this is about the other symptoms that the patient spoke about. Like you can see the screens from the students' papers here. I can understand if, for example, one student writes soft throat, so something wrong with the throat of this person. But for example, there were such phrases as source food. Well, of course, it's wrong. It's a mistake. So if you are not sure about the spelling of some term, please consult the dictionary. So you had enough time to do this. So as you can see, the right spelling of the symptom is sore throat. It should be like this. Well, and now, do you have any questions about the homework? No questions? Mm-hmm. I see. And now let us start speaking about the responsibilities of people involved in medical practice. You can see here 3 pictures, and so let us think of what is happening in the pictures and what do you think happens before and after this. So Akram, will you comment on picture A, please? Akram?
Yes, I'm here.
What is happening?
I think it's a doctor that's trying to lie the patient on the bed. For diagnosis.
Okay. Yes, okay. And so what do you think he did before these actions?
Well, before he just takes the blood pressure. He takes the diagnosis. The diagnosis of the patient. He just diagnosed the patient, take the blood pressure and temperature, for example. And he let him go to lie in the bed and see what's the issue with his with his illness.
To examine the patient. Okay. Yes. Great. So, and picture B now. Yahya, are you here?
Yes.
So what is happening in picture B?
She types some information about the patient. It may be the receptionist.
Mhm. Okay, so maybe she's completing the case history after the examination of the patient, and you can see a pile of papers on the table next to her. She's revising the case histories of different patients. Okay, okay, now about picture C, let's listen to Mustafa Sabir. Mustafa?
About lecture C, about
Yes,
lecture
picture C.
C, doctors do examination for patient.
Okay. One of them is a little bit elder than the others. The doctor who is doing this kind of manipulations.
I
Yes.
think
Okay.
other two doctors, women and men, they assistants
Mhm.
doctors.
They are assisting this doctor. Okay. Nisanur, what would you like to say?
Is it possible that the elderly man is a professor and two other people are just students? Because it seems like you know, like those fake human bodies that you like learn CPR on, like practice CPR on.
Yes, it is. Of course, it's possible. Maybe the professor is teaching the junior doctors how to do this kind of procedure, and then after they will just try to do it themselves. Okay, and well, and if we move to the next slide, we can see 3 more pictures. And now let us listen to Mustafa Ahmed. Mustafa Ahmed, hello, are you here?
Yeah.
Okay, what can you say about picture D? Where are the people? What are they doing?
Picture D. Okay. I see that the patient family is visiting him, and wait.
So
and doctor. Wait, I see the patient family visiting him, and doctor showed to them show to his father about a report.
You mean that one of the people standing by the bed is a member of his family? They're saying hello to each other, and the other people are doctors. Yes.
And
Okay.
and doctor showed his family about examination.
Explain something.
Examination report.
Maybe some kind of results of the tests.
Yes.
Okay, great. So they are in a ward in a hospital, actually. So good. And Hassan, Hashim, are you here?
Yes, Doctor, I'm here.
So please comment on picture E.
The doctors discussed with other.
What are they discussing? Sorry, didn't get it.
What?
Will you repeat, please?
Doctors discuss with us together.
So they're discussing something. Yes, some professional issues. I see. Yes, because so it's necessary to discuss sometimes just to to consult the colleagues or specialists to diagnose, to make the correct diagnosis. Okay, and in picture F, what is happening there? Let us listen to Yasmin. Yasmin, hello.
They are two doctors. They are discuss about something. The doctors say the other doctor something, and he is tiring, I think.
Okay. You can see that one of the doctors is yawning. He looks
Tired.
tired. Yes, so it means maybe this is the end of his shift. That is why he's tired, and he's just giving information to the other doctor who changes him in his shift. So about the information about the patients. Okay, this is just these are the typical situations in a hospital, and here there is definition to the word ward. A ward is a separate room in a hospital, typically one allocated to a particular type of patient. So like here in picture D, this is the people are in a ward. Can you remember your experience, your feelings when you were in a ward for the first time? Have you ever been in a ward? So who can share your just what your feelings, or what did you feel? Hassan Muhammad, are you here? Hassan?
Yes, doctor.
So have you ever been to in a ward?
No, actually.
No. Okay, who has been there? Shema? What about you? Is Shema here? Shema? No. Nisanur?
I don't think I've been in a ward, but I've been hospitalized a bunch of times because of asthma attacks.
You've been hospitalized, right?
For asthma attacks.
So it means that you've been in a ward, because this is the
Not really, because I have been all like I always been in like those emergency rooms where they just treat the patient immediately. Like it was more on I don't know how to say it, like on foot, let's say. I've never
see.
been like in a ward for a long time, or like more than an hour.
I see. Anyway, did the doctors help you?
Yeah, of course. I don't actually remember much, but I remember that I've been to an ambulance, and then they have like tried to treat me with those asthma medicine, like the ones that you spray into your mouth, and then it got even worse. So they had to put me in a ward for like half an hour to wait for my blood test results and blood pressure results to come back, because I've also have like been like having appendicitis problems. So they were like curious to whether if that affected anything.
I see. So anyways, we understand that the doctors should be very fast in making their decisions, and they should
When it comes to stuff like asthma attacks, it's like more, it has to be really quick. So I personally don't know anything about being in a ward, but I know that as a child, like when I was 3 years old, I was apparently like, I had an operation in my stomach because I couldn't move my stomach muscles. Like whenever I eat food, I will pick it back. So My parents told me that I've been in a ward for 2 days because of that. So that's all I know.
Mhm, mhm. I see. I see. Okay. So, of course, it's very just sad experience when a person goes just to a hospital. Hope you won't do it, I mean, as a patient, but only as a professional. And now, if we move to the next slide, so there is definition for the phrase ward round. The ward round is a visit of a doctor in a hospital to each of the patients in a ward. So the doctors do ward rounds regularly, normally every morning, so with a group of nurses and specialists, just to make decisions about the condition of the patients, what to do with them, prescribe some medicines and further treatment. And so on a ward round, so when people go for the first ward round, I mean the doctors, so they need some just maybe help to feel more confident. And here are some tips for a first ward round from an experienced doctor to a junior doctor. And let us read them and answer the question, why do you think each tip is given? Why is it important? So now, and let us listen to Yunus. No, sorry. Let us listen to Akram. So the first tip, please.
Okay, so
Read it, please.
okay. Word rounds. These are the tips for the first word rounds. What do you think of each tip is given? Make sure you know the names of your patients and where they are.
Why is it important to remember the names of the patients?
The familiar, so make yourself familiar with the patients. Also, it helps to get more information about, for example, where he is, also what diseases are spread in his country, especially if he came from African countries, in the south countries.
Yes, and the patient will see that the doctor really cares about them, and so yes, and they trust the doctor more if the doctor addresses them using their names. Okay, so what about tip B? Let us listen to Yahya, please. Read it.
Find out from the web managers if any patient have been moved and to where.
Why we should do this?
It's something like clean and for comfortable to the patients.
Okay, and for example, if you don't know, so that the patients have moved, have changed their just places in the ward, so you'll just won't know their diagnosis of these people, so you can't understand who is who. So you should just keep in touch with bed managers about this. Well, now the next is for Mustafa Sabir, please. Tip C, read it.
Check that all case notes, investigation, and so on are on the ward.
Why is it important? Case notes. Yes.
Me easy to diagnosis.
Exactly. So you can get the information about each patient from the case notes. Mhm. Okay, so the next D tip is for Mustafa Ahmed. So read it, please.
Yes, doctor. Okay. Invite a nurse who knows your patient to come on the ward round.
Mhm. Why should doctors invite a nurse?
Because the nurse knows the condition well and knows what he suffer
Mhm.
from and help explain to his and help explain his condition.
Mhm. Okay, so sometimes nurses are closer to the patients because doctors only prescribe medications and just treatment, but the nurse just does the nurse does the injections and gives medications to the patient and just yes, you're right. She knows or he knows better so about the conditions. The condition of patients. Mhm. Okay, and now line E is for Hashim Hassan. Read it, please.
Record the case histories and the results clearly and concisely.
Why should the doctors record case histories clearly and concisely?
To identify common satiric symptoms and comment on impact to illness and patient life and to notes details of the previous treatment.
Mhm. So and so these notes should be understandable for the other doctors who treat the same patient, right? Mhm. Okay, now if we move to the next slide. Yes.
Unit 3.
Just a minute, and now we are going to listen to to the comments, to the reasons given for each tip, and we should complete each reason with some words that we hear, and we should use no more than 5 words for each gap. It means this is like we have the same A, B, C, D, E tips like on the previous slide. The doctor is commenting on each of the tips here. For example, make sure you know the names of your patients and where they are, as you want to demonstrate that you are, and we should listen and write what she says about each tip. Now let us start listening, and you'll tell me if you can hear.
Unit 3. Listening 1. Unit 3. Listening 1.
Can you hear?
Yes, doctor.
Okay, now I'll start.
There are many things that will become obvious once you have done your first ward round, but I can give you a few tips that helped me on my first day. The first thing is, make sure you know the names of all your patients and where they are in the ward, as you want to demonstrate that you are familiar with your patients. The next tip is always check with the bed managers if any patients have been moved, and if so, where to, in order to avoid wasting time, especially the consultants, running around looking for patients. Also, make sure you have all the case notes, x-rays and so on hand so that you can refer to them quickly. It is useful to invite a nurse who knows your patients to come on rounds with you, because they may be more knowledgeable about the patients on the ward than you are. As regards the case histories and results, record them clearly and concisely. In that way, you can access information easily.
Mhm. Well, and I guess we need to listen for the second time.
Unit 3. Listening 1.
There are many things that will become obvious once you have done your first ward round, but I can give you a few tips that helped me on my first day. The first thing is, make sure you know the names of all your patients and where they are in the ward, as you want to demonstrate that you are familiar with your patients. The next tip is always check with the bed managers if any patients have been moved, and if so, where to, in order to avoid wasting time, especially the consultants, running around looking for patients. Also, make sure you have all the case notes, x-rays and so on hand so that you can refer to them quickly. It is useful to invite a nurse who knows your patients to come on rounds with you, because they may be more knowledgeable about the patients on the ward than you are. As regards the case histories and results, record them clearly and concisely. In that way, you can access information easily.
Mhm. Okay, now what have we written? Yasmin, please, what did you write in line A? Yasmin?
As you wanted to demonstrate that you are, as I remember, a familiar.
With whom? So you as a doctor, you are familiar with whom? Who can help us?
Me,
Yes, please.
with your patient.
With your patients, yes. Right, okay. Well, the next line is for Mohammad Hassan.
Yes.
Mhm.
Looking for patient to avoid wasting time running around.
It's like tip B.
Yes.
Find out from the bed managers if any patients have been moved and to where, to avoid wasting time. She says, especially the consultants running around, and you say, doing what? Running around, looking, as you say, for
Looking
patients.
for patient.
Yes, looking for patients. So to avoid this situation, that so the other doctors start looking for the patients. Okay, now Nisanur, please. C sentences for you. So this tip says, check all the case notes, and she says x-rays, investigations. So on the ward, so that you can, Nisanur, you can do what? Nisanur, are you here? No, she's absent. Well, Akram, what did you write here? Akram?
Okay.
Yeah. Mhm.
Yes. In the last one,
No,
is it?
C.
I would say it's refer to them quickly.
So you can refer to them quickly, okay? So then the next D, you should invite a nurse. Why should you invite a nurse? Let us listen to Yahya, please. Yahya?
Yes. These sentences, because they may be more knowledgeable about
whom?
About the nurse.
No. So the doctor should invite a nurse who knows about the
Who
patient.
knows?
About the
Yes.
patient.
Because the nurses may be more knowledgeable about whom?
About the case of the patient.
Yes, about the patients, on the ward, so she says. And the last tip is about writing the case histories clearly and concisely. So why should we do like this, Mustafa Sabir? So line E.
In that way, you can
You can what?
you can know more information about case.
Well, that was another phrase said by the doctor. So who remembers? Who has written this? In that way, you
Last
can. Yes, please.
Access information
Easily.
easily.
Yes,
Easily.
you can access information easily. So here are the tips. And
Unit 3.
if we go to the next slide, there is a question. Would you give the same tips to a junior colleague in this situation? Or you would give some additional advice? So, Hashim Hassan, what do you think? Do you agree with these tips? Or you may add? Yes?
Yes, I agree.
So you agree? And Hassan, do you agree?
Yes, sir.
I see, okay. Well, actually, it's not easy to give tips when we don't have any experience in working in a ward. So I think these tips are very useful. And the question. So the question here, we are speaking about some procedures. And why do you need to do these things before you carry out a procedure? So first, we say that we need to obtain consent from the patient for the procedure. Consent is the agreement of the patient. When you have explained to the patient what's going to happen, what kind of investigation procedure the doctors are going to carry out. So the patient should agree to this procedure. This is the patient's consent. And why is it important to introduce yourself and prepare the trolley? The trolley is, the picture of the trolley is shown here on the slide. So why do you think it's important? Nisanur, are you here? Nisanur, hello?
Yes, actually, sorry. The construction next door causes our electricity go down sometimes.
Okay, what can you say about this?
Obtain consent from patient, introduce yourself, perform trolley. So first of all, about consent, they have to be sure about what's going to be done to their body. It's their own body, it's their own choice, and no doctor, nor nurse, nor any health practitioner should carry out anything without the patient's knowledge or consent, because as I said, it's their own life and it's their own body, and they can do whatever they want with it. We can only, like, as doctors or like future doctors, hopefully, we can only delay that. We can't like cure it immediately. It's up to their own consent to do whatever we have to do.
What about
Well,
introducing
ourselves? They have to know our names as, like part of the consent. They have to know our names, know just like in case if anything goes bad or anything goes good, in both perspectives, they can like advise us to other people, or they can be
Yes.
sure where our background is from. Sometimes like most known names are related with good like hospitality or good care or good treatment. And about
Eating
preparing
foods.
trolley,
Yes.
it's really important for like sterilization of or clinical tools, like medical tools,
Mhm.
and to lay out, like organize what we need to do during the operation, as well as to let patients see what's going to happen.
Mhm.
So most of the time it's scary for the patients, but
Yes.
preparing the trolley is more important for the practitioners or like doctors
Yes.
or operators themselves for organization.
Exactly. To have everything on hand.